could move a little. You want to come in a little bit more? Okay. All right. Okay, we're good. Come around. So first of all, I want to thank everyone for attending our press conference today on one of the most critical topics that we all face, and that is the challenges with respect to mental health. Our family, our friends, our neighbors, and even many of us ourselves have suffered from challenges with mental health. The reason I know we all have somebody in our lives that have suffered with mental health challenges is because 1 in 5 Americans, adults, experience mental health condition in a given year. 1 in 6 young people have experienced a major depressive episode. 1 in 20 Americans have lived with a serious illness such as bipolar, schizophrenia, or a major depression. And sadly, one of the leading causes of death in the United States is suicide. In fact, suicide impacts our 10 to 24-year-old age group. Suicides in 2020 were 50,000 residents of the United States, which was double the amount of residents who lost their lives due to homicide. While there's help available, we know that there's still a struggle in seeking help because of the stigma that's attached to mental health. Mental health and seeking help is a strength, but it was tagged as a weakness for so many years. And that narrative is starting to begin to change, but it's not changing fast enough. And that's why we're here today, because we want to bring awareness to the existence of mental health challenges, but we also want to let our residents know that we recognize it and that there's help available. I always like to share my own story because at a young age I suffered from mental health challenges. I grew up in a family. My parents had substance abuse issues, and back then you didn't talk to anybody about what you were facing internally. You hid it. Didn't even tell my own friends. It was a struggle, anxiety, stress, embarrassment. It's very lonely when you're suffering and you don't talk to somebody about it. To the point where I think I was becoming a little obviously fragile, and a friend came to me and said, I think you need to talk to somebody. And I reluctantly went, and it was life-changing for me. It helped me navigate through a difficult time, and it's something that I tap into through all of my adult life. So seeking help is something very important to your mental well-being. So I thank everybody who's in this field that offers the services, who trained to help people that are struggling. And today we will hear from some of those who are medically trained in the field, those that counsel those who are impacted with mental health challenges, and you will hear from our own department heads as they talk about what services are available and how our residents can seek help, because at the end of the day, we are all one big family and we want to help each other. So with that, I'm going to turn it over to our Health Director, Maureen Lillis, who has been a champion at the City of West Haven to help bring parity to mental health healthcare as we do with our physical health care. So with that, I'm going to turn it over to Maureen, who is going to introduce our other speakers. Maureen?
Thank you, Mayor. Good afternoon, West Haven. What a great day for a press conference. Today and all through the month of May, we will emphasize the importance of mental health awareness, a topic that is too often ignored and gets placed on the back burner. But it's one that we cannot ignore. Mental wellness is important to our overall well-being, not just for ourselves, but our communities. We know that poor mental health conditions, including depression and anxiety, are strongly linked to the onset of chronic diseases, such as cancer, heart disease, stroke, diabetes, just to name a few. These diseases can reduce life expectancy, sometimes by decades, due to higher stress levels, disruptions in sleep and nutrition, increased risks from substance abuse, and great difficulties in securing medical care or social support. Bring the COVID-19 pandemic in, which contributed to the rise of mental health illness and suicide ideation due to the fact that many people were impacted by social isolation, job loss, financial issues. Between February 2020 and the end of 2021, about 1 in 4 Connecticut adults lost a job. 1 in 5 reported that they or a member of their household had consumed alcohol more often than usual. And 18% had experienced the death of a close friend or family member from COVID-19. Adults experiencing hardships such as food and transportation insecurity, unemployment, lack of timely medical care, and limited social support were more likely to report depression and had much lower levels of personal well-being as measured by the Data Haven Community Well-Being Survey of 23. The pandemic also had a disproportionate impact on vulnerable populations, which may have contributed to additional suicides among these populations. So suicide is a major public health issue and can be recognized as a chronic epidemic. Despite the overwhelming numbers, the tragedy of suicide is hidden by stigma, myth, and shame. And it's the stigma surrounding suicide that restricts prevention and intervention. It would be remiss of me if I didn't give you a few statistics from the CDC. The US had 1 death by suicide about every 11 minutes. It's the 3rd leading cause of death among 15 to 25-year-olds and the 2nd leading cause of death among 25 to 34-year-olds. More than 950,000 youth aged 12 to 17 and 1.6 million adults attempted suicide. In 2022, an estimated 13.2 million American adults seriously thought about suicide. But there is a glimmer of hope. I want you to turn your focus to that poster and remember this life-saving number. It's just 3 digits that can save someone's life. The 988 Lifeline helps thousands of people struggling to overcome suicidal crises or mental health-related distress every day. Launched by the U.S. Substance Abuse and Mental Health Services Administration in 2005, the 988 Lifeline serves as a universal entry point so that no matter where you live in the U.S., any time of day, 24/7, you can reach a trained counselor who can help those experiencing mental health-related distress. In addition to raising awareness this month, our plan is to sponsor events throughout May, which will encourage open dialogue, create a new culture of empathy and understanding, and emphasize the importance of normalizing the practice of self-care and taking moments each day to prioritize your mental health without fear of embarrassment. We will work to reduce the stigma. It is my fervent belief that each and every one of us has the ability to be an agent of change. Look out for yourselves and look out for each other. I do thank you for coming today. It's very nice to see this group here. I'm going to turn it over now to Chief Michael Terenzio, City of West Haven Fire Department, Allingtown.
Thank you and good afternoon. On behalf of my fellow firefighters here in the city, represented here Chief O'Brien of the Center Fire District, Chief Scaffarello from the West Shore Fire District, Director of Emergency Services and Emergency Management, Rick Fontana. I'm speaking to you today about what firefighters refer to as the invisible injury. You can't see the injury that happens to behavioral health and emotional stress. But let me tell you, after serving in the fire service, well, longer than I care to admit, but it's well over 4 decades, many of us suffer from PTSD, and it's the firefighter culture that can be a friend and a foe, because as was already related to by our previous speakers, no one wants to admit that they're suffering from some kind of behavioral or emotional stress. And least of all is our firefighters, but we're becoming more and more aware of it. And through Chief O'Brien and the Center Fire District's efforts with Danny the fire dog here, handled by Captain Urban, we're trying to address that here in the fire services that protect the people here. And with the increase of the known behavioral and emotional stress injuries, It's amazing to know, according to the Emergency Services Medical Information Reporting System, only 8% of calls nationwide are behavioral and emotional stress related. It doesn't quite jive. So what that tells me is that there's a high incidence, but no one's reporting it. And when we have to be ready to respond to those types of calls, we are trained as EMTs and paramedics on how to deal with that without that type of injury, without having where to put the bandage or where to put the splint. It's a whole different ballgame. So on behalf of my fellow firefighters here in the city, believe me, PTSD is a real injury, and the best thing to do, as what the mayor also alluded to, we don't want to say it, but we have to. We have to admit that it exists, and we have to be ready to seek out the help. And there's a lot of help here that can be afforded to everyone here in the city, the state, country. Don't be afraid to admit it. I will admit it. You need help from time to time. Don't hesitate getting it. Thank you.
I'd like to now introduce Alyssa Mattern, Director of Elderly Services, City of West Haven.
Thank you, everybody. So just like my colleague said, mental health is more important more and more every day. While prioritizing and promoting today as a special month, I don't want to ignore it all year round. So I'm happy that we had this gathering today. So as the Director of Elderly Services, I'm around seniors who are 55 years young and up, and they are all independent, wise, and vibrant in all their own unique ways. However, also within my role, I experience and serve seniors who may be struggling with their own mental health issues that stem from varying factors, such as loneliness, isolation, and so forth. Though many seniors I come across come from a generation where you keep your feelings to yourself because it's a sign of weakness. They're gonna look at me funny, all these different things. But more than anything else, it's to be, I would say, embrace what you are. A lot of people I deal with every day are really scared of it. They don't wanna have those feelings because who wants to feel those feelings? So instead of being scared of it, I say let's embrace that. Let's go seek help and see who we have. We have all the support teams here. Furthermore, I would like to make sure that people are aware that the Senior Center is there not just to have fun every day, but to get that socialization back. I know we all miss it because of this pandemic that we've all experienced, and I hope that it shines a light to everybody that we're here to help. Thank you so much.
Next up is Center Fire District Community Partnership Program, Captain Jacob Urban and Danny the dog.
Buddy, did you use it out for me? Right on cue. So your turn's next. So to steal from, he's gonna do that the whole time. To steal from one of my favorite authors, firefighters are like everybody else, but just more so. We go through the same mental health struggles that other folks see. But in addition to that, we do see the best and worst in humanity, and we see that every day. And so it is at the forefront of our thoughts, but mental health and wellness has not always been at the forefront of how we handle things. It's one of those things, again, like everybody else has said, you push down and you don't talk about. And we're starting to see that now, that may not be the best way to handle things. Matter of fact, that's probably the worst way to handle things. So having that conversation is very important. And over the last few years, Chief O'Brien, Deputy Chief Pisani, Deputy Chief Johnson have supported the firefighters, making sure that they get what they need on the wellness side. That's why Danny's here. Everybody loves a dog. How could you not? Everybody loves a firefighter, and you put them together. It's a little touch of humanity we get at the firehouse. So it's really important that we focus on that when we're home at our firehouse, so when we go out in the community, we can provide better support. And in that, moving forward, we're looking to make sure we can partner with all these other great organizations within town, in the community, to help provide a little bit more mental health and wellness services. You know, we focused on the emergency side 20, 30, 40 years ago, but now we're seeing, as Chief Terenzio said, you know, we're only labeling 8% calls as mental health and wellness. And I can tell you from being a provider, it's probably half the folks we see could use some more intervention and some more interaction. So the fire departments in town are going to focus on that a lot more in the future and work agency-wide to have that whole community approach. So we appreciate being part of this conversation, appreciate getting this out there and the message to everybody. So thank you. You going to say thank you too? What do you think?
Karen LaFaux, Assistant Director, Pupil Services, West Haven Board of Education.
Unfortunately, mental health is something our students are facing every day in our school community. Younger and younger, our students are facing these obstacles, but still managing to make through and come to school and enjoy their school day. Our schools pride themselves in providing Tier 1 interventions to promote a safe and healthy school community. We're so fortunate here in West Haven to have social workers, school psychologists, as well as school counselors and community outreach workers that support our students and their families every day. Our support staff works with our students both individually and in small groups to support them academically as well as with their social emotional needs. Our staff meets with parents and outside providers and collaborates with the extensive needs our students have to make sure that their school day is just about learning. We also work with our families very closely to connect with all of the resources we have within this community, which is vast. We're also very fortunate to partner with our school-based health centers. So we have our school-based health clinics housed in our elementary, our intermediate, our middle, and our high school. They provide clinical supports to our students who may have a struggle to get to those services outside of the school day, so we're able to provide them during the school day. We also work with them as collaboration with our in-school staff as well as with the outside providers. We also have them working with families outside of school, sometimes in the home. But whatever we need, whatever our students need, we do our best to provide. Thank you.
Dr. Tech, Chief Medical Officer, Mental Health and Addiction Services, Cornell Scott Hill Health Center.
Thank you very much. I'm so honored to be here today. It's really I've been practicing as a psychiatrist for longer than 20 years in this state, but now what we are seeing, it's very sad. The demand is getting higher and higher. So we always say mental health should be treated no different than other healthcare needs. But it's very unfortunate and even alarming. This reality is a distinction that makes a difference. So this is now we are all aware, this difference in individual lives, in families, in our community, and it prevents people from getting the chance to get well. So thank you very much for sharing your stories. It's very important. The more we share the stories openly, the more we spread hope. And hope, the more we diminish the stigma, hope will become our reality. So thank you. It's very important. And so I know many of us, we were aware of the mental health severity. But after the COVID, after the pandemic, now it's getting it's becoming our reality. It's our normal thing. So you mentioned 20% of people in the United States, they suffer from some kind of mental illness, but sometimes I feel like it's getting more. So to one of us, always someone is anxious, depressed, and so it's like we are now realizing the extent of this growing crisis. After the pandemic, now we are having another crisis, and the effects of these crises in our generations, our kids. So we will continue to see. It's very unfortunate after 10 years, 20 years, because these kids, they will grow up as chronically depressed or chronically anxious. This will become their personality, not only disease, but this will be their persona. This is my fear. So the most important thing, so we have, we understand at Cornell Scott Hill Health Center, I don't know if you know, so we have a couple of clinics here, school-based child behavioral health clinics and our big adult behavioral health and primary care clinics. But we always say mental health and addiction challenges are not one size fits for all. So this is the most important thing. So everybody's healing process, everybody's recovery is different. So So this is why don't compare with others. So you may not need medication. Just talking with someone will be good enough for you. But the others may need medication. So it's very important. We have to have person-centered treatment. So this is the most important thing in my mind. Now, this is the lesson I learned after 20 years. Everybody's recovery is different. Everybody is different. And this is, addiction can be just the other tip of the iceberg. So we are talking about mental health, but can we mention post-traumatic stress disorder, depression, and anxiety? So they can be the real reasons of addiction. So this is why we have to treat the real reason, and then we will treat the other things. And so these PTSD can be unbearable, and so can become addiction. So this is why it's very important. So this is the mental health, just the starter. But then after mental health problem, so we may have other things. So what we need to say, this is a journey, and this journey is filled with obstacles and often unexpected. So this is why it will not be easy. But with twists and turns, we are determined as Cornell Scott to stick with you, to stick with our people in every step of this journey. But the most important thing, stigma persists about mental health. So we have to accept this. And it prevents the full measures of progress from being achieved. We need to change the culture with transparency, with respect, and with collaboration. Thank you very much for arranging this day.
Louise Pérez, President and CEO of Mental Health Connecticut.
Good afternoon, everyone. It is such a pleasure and an honor to be here. Hearing from these speakers, you have a community that has created a really good safety net. From the mayor being able to share her story, that takes courage. From the firefighters acknowledging that they have conditions as well that may be hidden and are being hidden. From Cornell Scott saying, we are here to help, right? We have help. That's not the case in every community in Connecticut or in the country. So you should be very proud of what you are creating here. At Mental Health Connecticut, we partner with individuals, families, and communities because we understand the power of community. We understand that without knowing that your friends, your neighbors, your family are going to be there at every step of your journey and in your recovery, providers cannot really help anyone because they don't have the supports. I would like to also add to all of the things that have been said. You've heard the data, you've heard the expansion of mental health needs across Connecticut, across West Haven, across the country. Loneliness is something that is spreading. The largest number of reported lonely children, adolescents, and in particular, believe it or not, young adults. In school settings, in college settings, they feel isolated. And loneliness, as the head of public health alluded, is also a contributor to health issues. So we need to pay attention to those things. We also need to pay attention to the social determinants of health, because housing insecurity, food insecurity. I don't know about you, but if I had any of those, I would be incredibly anxious. I would be incredibly, perhaps reaching depression, and I would be passing that on to my children. So now you see the cycle, right, that starts happening when we don't address these things as a community. So again, honored to be here. Mental Health Connecticut stands fast with the town of West Haven, and hope you have a really great Mental Health Awareness Month. Thank you.
Jen Fiorillo, Chief Executive Officer, Bridges Healthcare.
Good afternoon, everyone. I'm very happy to be here and proud for Bridges Healthcare to be providing supportive services to individuals in recovery. Our organization provides services across the lifespan to adults, families, and children for addiction services and mental health, case management, recovery supports, and medication-assisted treatment You might see our mobile health van out here on the green because we're here about once a week. But, I want to talk a little bit more about some of the things that we see at our organization every day. In the last fiscal year, the agency served 40% more children than it did post-COVID, before COVID. So in 2022, we saw an increase of 40% of requests for services for children. What we're seeing in the schools, we have partnerships here in West Haven with the schools as well. We have clinicians that are embedded at 3 schools in West Haven, providing trauma-informed, evidence-based treatment. We're seeing high rates of suicidal ideation, high rates of homicidal ideation, and we're also seeing a lot of trauma, very complex trauma that we are now finally equipped to provide in a setting where people can access these services. In the last 2 years, we've expanded into a new clinical site out here in West Haven on Elm Street to provide clinical services across the lifespan. The one thing I do want to say, though, is that many, many people still hold the belief that mental health is really not part of one's overall health. And I can say unequivocally that we do everything that we can at our agency to meet people where they are in the recovery, to treat them with respect, to provide compassionate care. And if recovery is going to happen and it's going to be effective, you have to do it with the person in mind. Our providers don't dictate treatment. We allow the people to navigate what's out there, and we help them to get to the place where they need to be. So I'm very, very happy to be here today. I'm also very happy to be partnering with West Haven to provide mental health and substance use services to the community. Thank you.
Shoreline Wellness Center and Behavioral Health Clinic. Robert Powers. Okay. Kim Kenny, Outreach and Grants Coordinator.
Hi, everyone. I just wanted to first thank Mayor Borer and the West Haven Health Department and Michelle Caprio for inviting us here this afternoon, and everyone who had a hand in this kickoff to Mental Health Awareness Month. May is our chance to really talk about something that affects all of us in one way or another, mental health. In our community, we've always all been in it together. It's not just about one person. Mental health is about all of us looking out for each other. So let's use this month to break down any stigma around mental health. At Shoreline, we are here to support those in the West Haven community going through tough times. No judgment, just understanding and kindness. Let's take this month to show everyone that here in West Haven, we've got each other's backs. Thank you.
Eddie Cordova Coelho, Addiction Medicine Case Manager and Latinx Outreach.
Cool. I'm gonna be honest with you, a little anxious, but that's okay, right? Mental health awareness. There you go. Thank you. All right, I'm a little late. Don't tell my wife. She'll get upset. I think mental health awareness is extremely important. I think something that is often not talked about, especially which resulted in the creation of my position within Fairhaven Community Healthcare, is the effect that mental health has on the Latino population. Right, being Latino, I faced a lot of issues when it comes with anxiety, depression, mental health, and there's a lot of stigma between our community that often stops us from talking about these specific points and talking about how we're feeling. This results in a lot of issues with substance use, which I'm part of the substance use team at Fairhaven. The other really important thing is to share the information. I know Cornell Scott is here, which is great, because I'm actually a patient there. But Fairhaven is also fantastic. And I think it's really good that we're bringing awareness that if you are undocumented or if you don't have insurance, you can still get access to care. I think that that's very important. I think that we should be spreading that information a lot more. So there you go. Like I said, thank you. Oh, look at that. Thank you.
Kate Saxton, facilitator of the Bereavement Support Group of West Haven.
Thank you. Not used to speaking in a microphone, so forgive me if you can't hear me. Thank you, Mayor, for opening up this mental health month and shining a little bit of light where there's usually darkness. And one of the things I have to actually acknowledge this woman, because, and I hope I don't cry, but I had grown up very young, lost my parents, which got me into the field of counseling, and I had a small private practice in Essex for many years. And then love kind of brought me over here. And I got into a business, just my day job of sales, and I'm not exactly happy with it because my heart has always been about helping people. Bad thing was I wasn't charging appropriately. You want to see me for free? Okay, you can see me for free. Counselor had problems making her bills. But anyways, Teddy McKenna, thank you so much for seeing through me that I really had this need to be in the helping profession again. And so anyways, briefly, we run a bereavement group on Wednesday nights. We had one running almost 3 years now, grew to 22 people, just happened to all be women. And so we started another one. Now we have about 14, 15 people coming to that original group, and I see some of my ladies here. Love you. Thank you for coming. We started another group beginning of the year, and we already have 6 people in there, and actually half of them are males. But one thing that's important is a lot of us come from an era where you just pull up your bootstraps, come from an ethnic background, Irish and Italian, where you don't show your feelings, you don't express yourself. After day 3, morning, then you're supposed to go back to work and just live again. Well, it's hard to live again when you've lost your spouse, your partner of 41 years or 41 months. I don't care how long, but you had a whole background that you're losing and missing now. You have present day that you're trying to deal with, you know, writing the bills, checks for the bills. And then you have all the dreams for the future that are now gone. You have to rebuild. By coming to a group where you're learning some clinical stuff, you know, I teach them about the stages of death and dying, but really this group is about life and living and learning how to live again, how to laugh again, how to love again. So thank you for supporting this group, and I'm sure the need is there for other groups in the future, but appreciate your time today. Thank you.
That concludes our speakers and our program. Thank you very much for coming. And please take everything you heard today out into the community and share it. Any materials that are here, please help yourself. And again, don't be afraid. Reduce the stigma. Have a good day. It's 7:30 or just before it gets dark. This evening, the candles in the window will light green, and you should see these spotlights behind me, or behind these posts, are also lit up in green. We will be lighting those lights for about several days. Thank you.
Hi, Mayor. I'm Maureen B. Brother.
Hello, how are you? I heard a lot about